Hi, good morning Carlos. My name is Juan Jackson. I'm your invigilator for the OET-speaking session on the 2nd of February 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you tell me your full name for the record, please?
My full name is Carlos Wilson.
And what is your candidate number, please?
My candidate number is 234281002.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
How would you change your communication style if the patient's family was having trouble understanding what you were trying to tell them?
Usually, I review the instructions before I give them to the patient. And I always make certain that I have written ones for them as well. When I review instructions, I decrease the stimulation in the room and make sure I have their attention. Also, they are not hungry or tired or something else. I look at their faces when I am talking, and sometimes you can see the confusion, even if they are saying that they understand. Even when they say they understand, I ask them to either show me or explain back to me what I need them to know. Watching them tells me what I missed, and then I keep instructing in different ways until they can explain it back to me.
Tell me about a time that you had to deal with an unexpected emergency on the job.
During my time working as a nurse in a rehab facility, we worked with many patients who were detoxing and are having from extreme alcohol and drug dependency issues. One late night, a patient in the detox unit was threatening to harm either himself or staff, and the unit was put on lockdown. As the nurse in charge of that unit, I used my de-escalation training to calm the patient down to a relaxed state through simple conversation. If I did not have that training, I wouldn't have known the proper things to say and the attitude to have with him to calm him down. After the incident, it was back to business as usual on my unit.
Are you specialized in a particular area of nursing?
Well, I am not specialized in any area of nursing. Also, I don't consider myself specialized in a particular area of nursing yet. However, during my clinical, I excelled the most in the emergency department and critical care rotations. I attribute my success in these rotations, and currently work as a registered nurse in the emergency department in the local hospital. So, while I cannot honestly say I specialize in a particular area of nursing as of yet, I am most comfortable working with emergency and critical care patients.
How do you approach the documentation of patient records? Do you have specific strategies that you use?
I approach patient documentation very seriously, because I understand the importance of proper charting. In my practice during the internship, I used the workstation on wheels, which I would take with me into the patient's room. I would perform the assessment and chart in the patient's room as soon as I completed it. This kept my charting true to the time, and allowed me to see if my patient had any complications or improvements.
How would you handle a situation where a patient disagrees with you?
I try to first show empathy and understanding for their frustration, and when possible offer a blanket apology that they are experiencing this, and allow them to vent if possible, before I start talking. I stay kind, focused, and direct, and I am mindful of my personal space. I always try to pay attention to my words and body posture. I don't touch them, or give them false assurances. I try to remain in their space as much as possible, and be a kind, calm presence for them.
Great. Thank you very much for sharing that. So, let's move on to role play now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there is anything you are not sure about, and you can make notes on the role-play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your role-play. Don't worry if I stop you when the time is up.
Good morning. My name is Carlos Wilson. I am one of the registered nurses working in this community health center. May I know your name for the record, please?
Good morning, nurse. My name is Juan Jackson.
Hello, Juan. May I know what brings you here today?
Well, I am going on a trip around Southeast Asia soon.
Okay.
And I know that I have to take malaria medication.
Yes, you are absolutely right.
Yes, but nurse, I have had depression in the past. And I have read that there is some malaria medication that I shouldn't take.
I understand your purpose for visiting us. I can help you as well. But before proceeding further, I would like to get a few more details about your trip.
Sure. What are all the details you are looking for?
Juan, if you don't mind, can you please brief me about the trip in general? Like duration and kinds of places you may visit?
Yes, of course. I am going to be traveling for a month. And it will be mainly in rural areas, but plan to visit some cities too.
Thank you for giving me an insight into your trip. Now, I will suggest some medications for you.
All right, nurse.
I would recommend doxycycline for malaria prophylaxis. For your information, the medicine has no contraindications with your history of depression.
Good to hear that, nurse.
All right. Now, I will provide the details of the dosage.
Okay.
Juan, you have to take 100 milligrams of doxycycline daily with food. 2 days before the trip, during the trip, and 4 weeks after return.
Well, nurse, I don't like to take the medication for so long, when I return.
Oh, I see.
Instead, I can just try to avoid getting bitten by the mosquitoes.
Your words are quite sensible. However, it is equally important to have both medication and bite prevention measures. Juan, I would like to highlight the point that, during the trip, you may be visiting the high-risk areas. And also, the length of your visit is also to be considered.
Yes, nurse, I can follow your words. But, such a lengthy medication regime is not appreciated.
Your thoughts are really understandable. Nevertheless, the reason for a long dose of doxycycline is really necessary. If you are not taking proper medication, that could allow time for the multiplication of parasites, and finally you may fall sick.
Oh, is it?
Hence, it is a must to take the full dosage of the medication, as I suggested.
Yes, but nurse.
Well, Juan, I would like to know the reason for your reluctance to take medication over a long period of time.
Actually, nurse, I don't want to take medications for a long time, because I am worried about the side effects.
I really appreciate your concerns about the side effects. Juan, I am glad to explain the details of possible side effects. May I?
Sure, nurse, I would like to know about it.
Most common side effects of the medication are heartburn, upset stomach, and increased risk of sunburn. However, all these side effects are easily manageable as well. So, I strongly recommend you proceed with the suggested medication and have a worry-free trip.
Okay, nurse.
Juan, I would like to provide some information to you on what if you do not comply with the preventive malaria medication.
That is great. You may please proceed.
Juan, the risks of not taking medication can be severe than you think. If malaria is contracted, even heart and kidney problems may occur.
Okay, nurse. Now, I understand the importance of the medication. I will comply with it.
Good to hear that. Juan, feel free to contact us in case of any queries. Bon voyage.
Thank you, nurse.
That is the end of your OET-speaking roleplay. All the best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.